And so, welcome everybody. We'll just get started. I think Pannaman is going to be joining in a little bit. And so today we've got a very wonderful practice session. And one of the things I want to begin by saying is that, we had a real session about nitric oxide. Do you remember anything about nitric oxide? Yes? Raise your hand if you remember something about nitric oxide being talked about. Yeah? People remember here? Okay. I just want to make sure all the Wednesday group remembers something like nitric oxide. Nitric oxide is produced, and Vinod Bhai had talked fair things about that. And I want to show you something. This is something that I meant to show you. It's a show and tell type of thing. And nitric oxide is a gas, first of all. It's produced in the sinuses, okay, here. And it is very helpful. When you take deep breath, you produce more nitric oxide. When you hold your breath a little bit, you can produce more nitric oxide. When you do abdominal breathing, like diaphragmatic breathing, you have a better chance of doing it. When you do other methods we'll talk about. But when you do humming, we did the Om chanting or humming, it produces nitric oxide. Nitric oxide is very good because it opens up the airways, a lot of air coming in. It also opens up the blood vessels so that real exchange between the blood and the oxygen takes place very efficiently. Very important, efficiently. Number 3, it also is antibacterial. It is, it doesn't allow the bacteria to grow, and also viruses. We already know about the viruses, and there's been a lot of studies done on that also. Now, can you tell if you as a person is producing enough nitric oxide?
Okay, what's the story? Your dad is doing or not doing?
No, I asked him. He said I could take the machine, but
Quickly mute these people, okay? Okay. Thank you. So what I was going to share with you is something some of you may be familiar with. If not, we'll still show you. It's called nitric oxide test strips. How many of you have heard about that? Raise your hand. Akul Bhai, obviously the pharmacist, the pharmacist of the group, they already know. Raise your hand if you have used them. You just sell them, huh? You just sell them, you don't use them. That's the difference. That's the difference. So I'm going to show you something, and I hope I can show you good enough so that it demonstrates it well. Now, these are the kind of strips, okay? Now, I don't know if you can see the difference between the two. There's one on my left hand. It's a lot more pink, lot stronger color. This is when I got up in the morning. You do it in the morning. Take a little saliva. Don't put this in the mouth. Take the saliva and put it. And where is it? I showed it. Yeah, here it is. How to hold properly. You see it? Dark color, okay? It turns this color. That indicates that nitric oxide production in me at that time was good. Now, we did also say something else. That nitric oxide, if you use antiseptic mouthwashes, antibacterial mouthwashes, any kind of antibacterial mouthwashes, particularly if you use it frequently. If you use it once in a while, it's okay, once a day or something. But if you do twice or thrice, they have done studies on this, particularly people who have high blood pressure. This is a fascinating study. They had high blood pressure, and then they used mouthwashes. their high blood pressure was not as easily controlled because they were not producing enough nitric oxide because of the mouthwashes will bring down the nitric oxide level. The one on this side I have is after a mouthwash that I did. I mean, not immediately after, but what I'm saying is this is after the mouthwash. Look at the difference, okay? See the difference? Can you see that? Appreciate there's hardly pink, this the other side. This side is hardly any, color change. And that the lighter color means I did not produce nitric oxide. Now, this is very helpful. Now, how accurate and all, I guess I have to take the word for this particular test. And see, there have been studies done on this, but nitric oxide production is very helpful. So when you do humming, let's do the humming part. We are doing the humming, and I know that some of the people are going to explain something else, and we have other plans as well to do other things. But I just want to make sure that we repeat the humming part. So let's do this. Sit in a nice, comfortable posture, feet on the floor, well grounded, and posture is straight. Neck is straight. Inhale. Exhale. Inhale. Exhale. We do it 2 times to set up ourselves for the practice. So now when we inhale, and then go inhale again. Any pitch or any sound is okay. Feel the vibrations around the mouth or some in this area. Now, next one you're going to do, you're going to clench your teeth, close your teeth a little bit more, lips also more when you hum. So inhale, clench your teeth, and now hum. Inhale again. So when you clench your teeth, how many were able to feel this a little bit more on the raise your hand? How many were able to feel that a lot more in the mouth area? And then, okay. And the reason is simple, because sound gets conducted much better through a solid medium. It's that simple. It's not that. But we have sinuses. I want to tell you something about sinuses. It's an interesting question that people said, why do I have these big holes? What is the reason for I have sinuses? What do sinuses do? I mean, I get sinusitis. Our problem is sinuses. I wish God did not make sinuses, Why we have sinuses? One, of course, is that the air gets warm, the air gets, moisturized. We know that part of it. And also the antibacterial and all this stuff we said. But here is a thought, okay? As it is, the head is about 5 to 7 kilograms in weight, Sinuses, because there are like big cavities, it reduces the weight on the head. Head is a little lighter because there's cavities. So that's it's a very interesting aspect of it. Otherwise, we'll have neck ache all the time if the head was very heavy. Second point is, when you have, supposing there was trauma, somebody were to hit me, then the facial bones, they collapse. They collapse first. And when they collapse, or say you have a car accident, or the face back gets banged up or something. There's a collapse of the frontal collapse happens, front area. but the sinuses take the brunt of the trauma, injury. Otherwise, the brain, the important structures, the eyes, etc., they get protected because of this. Even though the eyes can be directly affected, they still protect the big trauma going to the brain. So we collapse of the front of the face. There's a special, the face people who do this kind of work, ENT and face, they call different types of fractures, we call it Lafort's type of different types of fracture. There are names to that. Don't worry about that. But the point is that is a protective mechanism. The sinuses are very important. It's kind of interesting how that works. And when you do this humming, the sinuses produce a lot more nitric oxide, almost about 15 to 20 times more. Okay. And they measure it in parts per million, ppm, parts per million, they measure it. 15 to 20 times more. So anyway, that's about the humming. I just want to make sure that we review some of the aspects. And so what I'm going to do, I'm going to now invite Haresh Bhai, and what he's going to talk a little bit about is a very interesting topic, actually. And the topic has to do with trigger points, pain and breathing. And whatever he wants to say, he will say. I'll compliment whatever he's going to do. He's going to demonstrate some stuff also. So Haresh Bhai, over to you. You unmute yourself, please.
Now, this is the new technique for the breathing pattern. It's a trigger point. Everybody knows we have lots of pain, sometimes in the body, sometimes we have pain in the neck, sometimes we have pain in the legs or some muscle spasm. Then this technique will be useful. So I'm going to show you the technique, and thereafter we will do everybody will gather this kind of technique. So let's just, suppose I have the pain in the neck, then put my hand on the neck, little bit gently rubbing, and inhale and exhale, inhale and exhale. In the pain in the neck and little, then you rub this way and like that. This side neck pain, like this, slightly gently massage on the head. I have pain in my shoulder, then I have to like shoulder, you treat like this, gently massage and breathe in and breathe out, breathe in and breathe out. If we have, then if I have pain in some problem in the heart muscle, then put the hands over here and then breathe in and put second hand, put on the belly, breathe in and breathe out, and must gently massage and rub like this and this. Sometimes we can put the hand like this, praying in the hand like this. This is also good massage too. Continue breathe in and breathe out. Don't stop in the any way. And another way, just you put on the head, and like this kind of tapping also good. This hair in the head like this, like this. Like this. So now I have another technique is that just we have also just in the past we are doing with small child, the mother was doing like this, galgalia, like this, scratches, scare, walking this finger, walking in the hand like this. This is also good technique for the blood circulation in the hand, like this. There's scratching like this too, it is good in the body like that. all over the body. Then that's it. Thank you. Over to Kalind.
What the interesting aspect about the trigger point and pain. Anytime one has had any kind of pain, I'm going to give you a background. That was very nicely done, Harishbhai. Thank you very much for demonstrating various methods. Basically, what he demonstrated was various methods of doing these massage and also using your own hands. How many of you have heard of Reiki? Raise your hand. Take time, raise your hand. Have you heard of Reiki? Everybody, okay. Well, this is self-Reiki. This is, how do you do self-Reiki? How do you do help yourself? The way you do this is you use your hands. And what's fascinating about the hands is your hands contain a lot of nerves. Tremendous amount of nerves. Is a very sensitive area. Face and hands, very sensitive. Two areas are very sensitive. The other areas have nerves, but their concentration on the face and concentration on the nerves and in your hands is too much. Not only that, but it's electromagnetic. In other words, it has, it conducts electromagnetic waves. And we know that from number of studies also. There are some studies done. Now, so when you use the hands in such a way that you transmit the messages. So when we do the massages and something like that, these meridians are like nadis. Nadis in yoga, they call it nadis, and otherwise we call it meridians in Chinese language. These meridians are electromagnetic, channels. And so when you do this, so let's do this, okay? Take a deep breath and breathe out. We're going to do an interesting, similar thing to what Harishbhai said, but we're going to do something else. Breathe and out. Now, let's say the shoulder is hurting, okay? So what you want to do is massage the shoulder like this. Take a deep breath and then flung it out. Throw it out. The pain goes away. Throw out the pain. Let it go. Let it go. Let's say you have a headache, and then shake it off. Work on this. You have knee joint, knee pain. I have knee up here. Shake it off. Hands are actually taking in all the negative energies and they can remove that. So the meridians can be cleared up this way. That's one. Second thing that happens with the pain is, as far as the breathing is concerned, anytime you have pain, what happens? Your breath always changes. Your breath gets shallower and faster. People who are in pain, they're trying to, they're worried about the pain and the breath gets shallower. There have been a number of papers and number of observations that when you are having any pain anytime, you slow down your breath. So just breathe it slowly, and you may do this hand raising if you want. Let's do this. Anytime you have pain, inhale and exhale. But slow down and take a deep breath and inhale and exhale. When you slow down your breath, when you deepen your breath, the pain will lessen. Pain studies have been done. People who have done, bad kind of musculoskeletal problems, trauma, injury, or people who are having recovery from surgery. There are papers on all this. And I don't know if Vinod, you have any feedback on the pain with breathing?
Of course, as you said, when anything that triggers the pain, it makes your breathing shallow and faster. And this we don't realize, but it does further accentuate your pain. And with the pain, there is anxiety. And the anxiety gets worse when you start breathing shallow and rapidly. And definitely, we have done in our practice any situation where you are uncomfortable. Best thing is to slow down your breathing by taking deep breath and breathe in and out, and that's number one thing we do.
Very good. Good. Yeah, you pointed out one very interesting aspect, that's anxiety. Anxiety increases, and second thing that happens physiologically is that because of shallow breathing and faster breathing, the carbon dioxide is removed. More carbon dioxide goes out. And anytime it becomes alkaline, pH becomes alkaline, or CO2 is less, the blood vessels constrict, it's called vasoconstriction. The blood vessels constrict and the airway constricts because it's called a sympathetic tone. That increases because of all this. And because of this, the pain gets worse. Pain gets worse. Now, many times the pain is because of not only the area that is bothering you, but also the muscles around. For example, the muscles go into spasm. So if you just go through, in your own hand, for example, if you run your hand on the shoulder and the arm here, just run your hand on the shoulder and arm gently and feel if there is any area of tightness or soreness. If you feel any area of soreness or something that's not right, it's not a good feeling. Sometimes you have it, or maybe in the back here. If you feel that the area is little sore, that is because of muscle spasm around that area. You must have had massages, right? Most of us have had some kind of massage, go to the massage parlor. And what they're going to tell you, oh, sir, this you're holding it too tight. You heard that? Your muscle is too tight. You need to little loose. You got a little loose. Why is that? Because the muscles goes into spasm, constriction. How do you relax it? Not only by massage, but by breathing. So when you massage your body, anytime you massage, take a nice deep breath. Say that you have pain in the neck area. Then breathe in and out as you do this, like Haresh Bhai pointed out. Inhale and exhale. Inhale and exhale. So try this if you have neck pain, if you have back pain, any of this, okay? Now,
let me add one more thing.
Please.
That especially the ladies who have gone through a childbirth. What we do in the labor and delivery, that when the baby is, we just tell them number one thing, take a deep breath, breathe out. Slow, deep breath, breathe out. And what does it do? It takes away the focus of the person from the actual pain. And it also helps in relieving the pain and making the delivery process a little bit easier.
Very good. Thank you. Lamaze type of breath. Lamaze type of breath that they teach you, and the husband knows it more than the wife. Husband becomes champion at doing it. He's not the one having pain. Oh, let's do this. I know how to do it. I'll teach you. Oh, come on, you're not having pain. So, but the point is, that's very good. Thank you for that feedback. And anytime you have injury, anytime you have any kind of pain, for example, you get hurt with a needle stick or something like that. Vaccination. Everyone had that, right? Needle. Did you breathe in? Take a nice deep breath and breathe out. You will not feel a needle.
Yeah.
You will not feel the needle. Believe it or not, it's very fascinating how when you breathe in and out, it will relax that muscle. If you tighten this muscle and that the needle goes in a tight muscle versus a relaxed muscle, what a difference. It's a little tip, if you haven't had the vaccination. But if you've had it, maybe next time you have to have a needle, you'll know how to get that, So breath is a handle. I like to say it that, and it's funny. It's not because I'm doing breath lab or breath clinic that I'm saying this, and not because it's It's and Vinod Bhai here is, he's a pulmonologist, so I mean he's giving so much of credibility to what we're saying. But what I'm going to say to you definitely is that there's no problem that the body or mind undergoes due to contact with the world or something happening with the world, something happening changes in the body, that the breathing center does not record or note. I'm going to say that again. This is such a classic and such a powerful statement I'm making, but it's a very, very powerful thing. Anything that happens around body, it could be pain, inflammation, sickness, chronic sickness, trauma, infection, childbirth, whatever it is, or mind, getting upset, somebody insulting you, whatever it is, or something didn't happen, suddenly something happens. Which center gets the first message in the brain? Vinod Bhai, true?
Yes.
Respiratory center and cardiorespiratory center. Yeah. And you know the reason why? Because this is even more classic statement. This statement is so powerful, and so I'm going to make that statement anyway. We have learned this in medicine, and I don't see Pannaben here today, but anyway, so that's no problem. The thing is, the body's first duty, when that body grows up, the brain's first duty is to protect and preserve. First response is to be safe. And the safety is mainly located in the lower area here, breathing and heart. Once you save these two things, the rest can come. Whether I can do my mathematics or if I understand science or not, that comes later. Or whether I get upset with talking to people or I cannot speak, all that comes later. First thing is, I want to make sure that I'm breathing. I want to make sure my heart is working. These are centers located here, down here, and in the lower part of the brain. And so that's where I would make the next statement. Because of this reason, because of the changes in the body, changes in the mind, changes in the outside environment, there's nothing that cannot be handled if you handle the breath well. Well, it may not entirely solve the problem, but it can be handled well. Okay, I'll let it sink in, because I'll tell you, anything is happening in your life, breathe better. Just breathe better, change your breathing pattern, and you will see how easy it becomes to handle whatever else you're handling, okay? And one of the most powerful messages that I'm realizing, and done a lot of other stuff, but I'm realizing it more and more now than ever. So having said that, I think who is going to be doing next? Do you know? Deepak Bhai?
Carol was going to do something, but she's not here.
She's not here. And are you going to do something? Otherwise, I can do something else. No. You're not doing anything. Okay. No. All right. Vinod Bhai, do you have anything to share? Any special thing?
No, nothing. I just to add something about pain and anxiety and breathing. We talked last time that this slow breathing is a part of the training in the United States military, also especially in the Marines, especially when they are in stressful situation. They take this, what they call as a box breathing we have talked before. And anytime there is a pain situation, it is alleviated, or at least it is made a little bit easier by taking breathing. And as Kalind Bhai has said before, that when there's an excitement and anxiety, there is a increased sympathetic activity in a system. We have got two systems we have talked about before, sympathetic and parasympathetic. Sympathetic is which aggressive. And by deep breathing, you're calming down the sympathetic system by stimulating the parasympathetic system. So we have got a balancing system which is assisted by controlling the breathing. Good.
Good, very good. I think that's very true. And one of the things that I'm very fond of observing is because I lived a very, very fast life. I paid for it because, I had a heart bypass and everything. But the point I'm saying that is a fast life gets you to the end faster. That's a fast life for you. And so slow down, slow down in everything, and particularly start with the breath. Breath is a handle, breath is a big handle. So now I'm going to tell you a little bit about diaphragmatic breathing, a little bit something more than what we have been doing. I was asked a question about, do we do diaphragmatic breathing all the time? I'm asked to do full breath. People, all the Swamijis and everybody, all the people say, take a deep, full breath. So why are we saying that? Why are we saying that you do diaphragmatic or the deep breathing that we do, okay? Well, the reason why we say that is because in any given breath pattern, okay, about 70 to 80% of the time, efficiency is done by the diaphragm, 70 to 80%. But the rest, 20 to 30%, and Vinod can add if he wants to change numbers, but this is the numbers that I'm aware of. Some of that is done by the chest muscles and the neck muscles combined. That's the amount. But the amount of breath work, most of the work is done by the diaphragm. Okay, most of the work is done by the diaphragm. So what we do in order to demonstrate that, we have done this before, but I'm going to do one demonstration we'll do, and the second one I have an additional one that we will go through again to realize the difference between the two. So let's put this one we have done before. So let's put the hand on the chest and the belly, and just don't let the chest move. Just inhale through the nose to the belly. Relax the belly and inhale. As you exhale, get the belly back all the way to the spine. Push with your hand. Relax. Relax and let it move. Just imagine how much of effort is it. Just think about the effort you're taking. It's only the muscles moving, chest is not. Notice the amount of effort that you're taking. Now, hold the belly tight, okay? Hold the belly tight and just take a breath with the chest and the upper chest and the neck. Don't let the belly move. How difficult is it, huh? It's much more difficult, isn't it? Because the chest is made up of all the ribs. It's a rib cage. And therefore, this is more, it's okay. 20, 30% breath is fine, but it's not efficient. Okay. So now another example I want to give you, and this is a test. This is something that you want to do. Now, this is the accessory muscle, okay? Right here. So, just at the base of the neck here. Now, with your nose, inhale hard, and your chest and your shoulder can go up a little bit. These are the accessory muscles, okay? Like that, right here. And the ribs also can go out, okay? So breathe with your chest only. Do you feel this muscle tightening there at the base of the neck? Yes? Do you feel it? Yes or no? Yes? Okay, yeah, okay. So most of them people feel it. So as long as you located the muscle, that's important. Now, there's a muscle deeper to that, but most of the muscles work in conjunction, They work together. They're like partners in crime, so that, they work together, they call it. We call it synergy, we call it a very nice word we use, synergy. Okay, so now let's do this, okay? For about, let's see, I'm going to give 10 breaths. Some people can do 15 breaths. If you can do it, do it 15, but at least 10 breaths with just the chest and this area. 10 breaths. Let's go. One. How does that feel? Getting tired? Yeah? How many have a neck pain? How many have neck pain? Yeah? Neck stiffness? Because what is happening is these muscles are lifting up that chest wall. They're expanding it both ways, but they're lifting it up in order to do this. And these are tiny muscles. They're not like diaphragm is big muscle. These are tiny muscles. Their efficiency of amount of work is the work that, so just imagine somebody's breathing like this. It's a lot of work, a lot of weight that has to come out, a lot of chest expansion that has to go. So recognize that, yes, you have to breathe. You have to get a full breath, like people always teach you. Take a very full breath. But recognize that it's not efficient. You'll get tired much easier. Your oxygen exchange also will not be as good. And this, I just wanted to do that as a test to show you that. The next thing I want to do is I want to show you the importance of posture. You know, like when you have the head straight, okay? Now, one of the things we don't do too many times, and I've got a very keen observation on this, and I want you to think about that for a second. In our life, okay, in our life, we live at the horizontal level. Our whole world is at the horizontal level. Why? Because we see at that level, we hear at that level, we smell at that level, we speak and eat and taste at that level. Touch is different. Touch you can do, different places and everything. But 4 of the senses are right here. How many times do we look down? When you're looking at the laptop or, the phone or reading. Yeah, that time we do. Even walking, if you don't look down, you fall, you trip. That happens. So looking down is not that common. Much less common is looking up. Now let's look up a little bit. Last time when I looked up, I realized that I need a change of this bulb, Wow, I need to change this one. But the point is, yeah, look up. How many times during the day do we look at the stars? Well, not sun, sun or the clouds or stars at night or moon. How often do we do this? Think about that, okay? Think about that. Now, why is that important? Because the head weight is the least in this position. And when you look up a little bit, the weight goes down this way, doesn't remain on the neck. It goes down a little bit further down here on this portion, okay? The weight line goes there. If it's straight up like this, then the neck weight is about 5-7 kilograms. When you bend it forward, it is about 10-12 kilograms. Particularly if you're down here, 50-60% angle, then the weight of that head on the neck muscle is about 25 kilograms. No wonder people have neck pains, That's why the neck pain happens. Now, it's not the pain part that I'm referring to now. I'm referring to the airway. This is an important part. When you see my airway from the side here, it goes from here and it takes a right angle. Now, anything that has to take a right angle, say you're driving, okay, in the car, and the car has to take a turn like that. You're gonna have to slow down. You can't just take the same speed. Air is no different. So, when you look up and breathe, just look up and breathe. And smile. That opens up the nostrils also. And then come down. Look down and breathe now. You find any difference?
Resistance.
Yeah, just do it one more time. Up and down. One more time. Up. Couple of breaths. Check if it's easy. Check if it's easier. It's a very fascinating thing. What do you think? Easier yet? You feel easier? Yeah. Majority of the time that is true, because even when, Vinod Bhai will tell us, what do they do when you put the breathing tube in?
You have to extend the neck.
Yeah, extend the neck. Why? Because it becomes straight, right?
Straight airway. You can put a straight tube in there.
Good airway. Now, something else, when the person is really getting unconscious, what do you do? If he's unconscious, what can happen? The tongue falls back, right? The tongue can fall back and person can choke on it. So what do? They pull this angle out and open up like this. Pull the entire in front. That opens up the airway. Just like we're opening up this airway here, the back of the throat, if the tongue is loose and the person is becoming unconscious and passing out or something like that, the tongue falls back because he's not conscious. That is like a muscle that is loose. The tongue goes back and it chokes in the throat. That happens to people unconscious, And so the thing to do is, anybody who is a conscious, thing to do is open up. This is a first aid thing that they do. Just there's something, some of you may know this, some of you not, but that's okay. That's the way you open up the airway. So opening up the airway by posture, consciously, is very helpful. Okay? And same thing happens while you're asleep. How many of you use what type of pillows? Now, Vinod, is there any study about people with pillows? And I'm not talking about, say, for example, congestive failure or something like that, but pillows, using of pillows versus in people who are having sleep apnea or any other study anywhere?
No, there is no study, but I think in general it is believed, I have not looked into it, that the thinner pillow you use, the better it is, because your neck remains extended and it helps your breathing.
Yeah.
And practically in sleep apnea also, that if there's a neck is extended, the symptoms are improved.
So thank you. This is very very helpful to have him, because then I'm not aware of some of the stuff that he's talking about, which is very good. So consciously extending your neck, looking up at the stars during the daytime, even if they are not there, it's okay, no problem. Just keep looking. You may find something, but it's okay to look at the clouds. It's okay to look at if it's a very clear day or something like that. Every so often, think about doing this. Every so often. It will be good for your neck. It will be good for your head. People are having headache, whosoever having this kind of thing. It will be very helpful. And breathe at the same time. Take a nice deep breath. And as I said, correcting the posture. I don't have right now the exact time for correcting the posture about the rest of it, but I'll show you something right now, because it's also correcting the posture when you stand, okay? So now let's all stand up. And here's what you want to do. You want to make sure that feet are comfortably separated. Now, how do you say it's a shoulder width apart? What you're going to do, I don't know if you're going to see my feet or not here. I'm going to go a little bit this way. If you can see my feet. Yeah. So what I'm going to do is I'm going to put a foot, my heel to the mid of the foot here. Heel to the mid of the foot. Like that. And then turn it out like this. So my one foot like so. It's like that, okay? And then open it out like this. If you do that, that's about the shoulder width length, about. Then you adjust yourself and be sure that the complete foot is resting on the floor. Some people have arch, less arch, whatever, flat feet. But whatever is comfortable, most of the surface hitting the floor. Then bend the knee a little bit, slightly. The spine comes down a little bit. Now this is a perfect posture for stabilizing your spine and stabilizing your breath. So what we're going to do is we'll do the same type of breath. Inhale and exhale. Inhale. Look up. Spread your arms out. And exhale. Sink down a little bit. Keep the spine straight. Knees slightly bent. Inhale. Exhale. This time bend forward a little bit. Exhale, get the back, get the belly muscle to the back. A little bit, don't overdo it. Inhale again. Exhale. Slow. Inhalation. The slower you do, the better. Exhalation. Last time. Inhale. Exhale. Now what we're going to do is one more thing I'm going to do and then we'll end. This is our diaphragm, okay, like this. So when you inhale, let the belly come out, the diaphragm is flattening out like this. Inhale, exhale. When you exhale, the elbows will come down here, sideways, like this. Inhale, exhale. This motion will help you understanding the ribs also coming out when you inhale. Inhale, exhale. Inhale, exhale. Now, this time, one more thing I'm going to do. When you inhale, tighten your belly now, front. Tighten your back. Now exhale. Now the perineum is like this, the pelvic floor, where you want to go to the bathroom, but you're holding on because there's a big queue in front of you. you can't really make it to that level, and I need to get this lower muscles tight. So tighten those muscles right now. Let's look at, just feel that, tighten those muscles and relax. The buttock as well as the perineum. Tighten again, relax. You're holding on to the stool as well as the urine, you know. One more time. This is important muscle, okay? Pelvic muscle. Relax. Now, so you have 4 muscles: diaphragm, front, back, and the pelvic floor. So it's like a box, okay? So what we're gonna do is inhale, hold the diaphragm there, right there, inhalation tight. Tighten the front, the abs. Tighten the back, and tighten the perineum. Everything tight, okay? It's like a box. Now relax everything, exhale. Inhale again. Tighten front, diaphragm, back, and the pelvic floor, pelvis. Relax. Exhale. Last time. Inhale. Tighten the front, back, pelvic floor. Exhale. Just a couple of nice breaths, deep breaths to finish this. Just relax. Always finish with a nice, normal breath. And have a seat again. Now, this one is a wonderful, which we call it, I introduce this as a core exercise. This is a core. Core is 4 walls, okay? Abdominal wall, back, the diaphragm, and the pelvic floor. It's like a box. Within the box, there's intestinal area with intestinal fluid. So when you hold it like that, it becomes a strength support. Have you heard of people wearing lumbar, you know, like, what do you call that? Belt, you know, belt to support the spine, right?
Lumbar support.
Lumbar support belt, yeah. Well, this is, you are creating your own support, lumbar support, with the 4 muscles. And when you do that, if you do practice this, people with back problems, people with a lot of things, we're talking only mechanical right now, only physical right now. There's so many other aspects to this particular core exercise. But this core exercise will be much more powerful for you in terms of, you know, building your back muscle, building everything. And even tummy can get less. Do more core exercise, you will have a lot more of, you know, the fat mobilization also. So this is, and then again, you have to do it with your breath, because diaphragm is very important in this particular practice. Okay, so just so that you know. All right, open for questions. I got a few minutes there. You can open for questions. Those who need to leave, you're welcome to leave. But if you have any questions, I'll stick around a little bit. Yes, Mukul bhai.
I have a question about nitric oxide
Yes.
tests. What kind of a test it gives us? Quantitative, qualitative, and how do we judge just by the color?
Yes, there is a strip that when you order the strip, it's a strip which goes your little color chart that comes with it. And the color chart will tell you if it's dark, you know, dark pink, even red, dark red versus light pink. The color chart has already showed you the pH part of it. Yeah. And that is qualitative. It's not as quantitative as you would like to have now. The carbon dioxide meters are there. Vinod can talk about that more if you can add that one. There are meters, carboxymeters, that are available, but they are mainly used, you know, not necessarily by common people. It's used for research. Vinod?
No, there is basically, I don't think we have except for research or hospital, they've got quantitative tests for the nitric oxide. But
Right.
this is basically tells you mild, moderate. It's just an ballpark figure.
Right.
So I have not come across any specific number. But we in the patients, in intubated patients, when we are giving them nitric oxide for breathing, we have a measurement, but that's not for home use.
Right. Right. And you know, this is not expensive. I mean, it is expensive as like test goes. There is some expense, but Mukul Bhai know about how much it costs. Do you know?
No, not really, but tomorrow I'll find out.
Right. And can you give discount to all these people?
I can give for nothing.
All the pharmacists in the group, please give discounts to all these nitric oxide
Of course.
researchers.
Everybody.
No, the thing about this is, I'll tell you why I'm saying this. You know, it's always nice to ask questions to the doctor. But when we become our own doctor, do we ask the same questions to ourselves? And if the things are available to us, are we curious enough to go follow and study these things? Let us be responsible for our own health, and this is available, okay? And I'm going to tell you, you know, when I started doing this is an older one I have. I just wanted to show you that when I started doing this, I said, wow, you know, this is important. And when I do it, what I did with humming, with this, you know, you can test it out yourself. And you will be convinced that, yeah, this does produce. I mean, don't take my word for it that it produces, you know. Get your body to learn that it does do that. Good question. Thank you.
Now,
So
next question.
is there showing the procedure of the testing, how to measure the?
Oh, yeah.
That's it. That's it.
Don't put
Okay.
the strip
Don't put it in the mouth. No, don't put it in the mouth. They
Okay.
actually tell you not to put it in the mouth. Simplest test I have ever done. Okay. Anybody else? Any other questions? Diane, welcome. You joined for the first time. Yeah, unmute yourself.
Thank you, Collins. This was wonderful. And I have been taking notes. And yes, this is wonderful. And what a lovely group. It was
Yeah.
great to meet you all. I've known Colin for a bit. I just started working with him on this particular, on the breath lab. And today was fabulous, Colin. Thank you so
Diane
much.
is a senior trainer with Tai Chi Qigong and Healer Within Foundation. She's a board member with Healer Within Foundation, and we go long back with learning these things. She also teaches breath work, but then looks like she's going to refine that more.
Well, only with respect to, you know, the Tai Chi and Qigong.
Next
But that
time,
involves breath, obviously.
next time you're here, we'll ask you to do a little bit of Tai Chi and Qigong breath too.
Oh, sure, why not?
Note it down, Deepak Kumar. This is it. She's volunteering now.
I think I was just volunteered,
You were volunteered? Okay.
but that's fine, that's
Yeah,
fine.
Gopi has a question.
Doctor, only in early morning, I need a Kleenex, like a watery eyes, watery nose. Then whole day I'm fine. There is no trouble in breathing. There is no issue for anything. Only in the early morning.
Are you a mouth breather?
A little bit, yes.
Do you snore?
No.
How do you know?
If I snore, my husband will scold me.
Okay. Do you have dry mouth when you wake up? Do you have to wake up and drink any kind of liquid during the middle of the night, or when you wake up, you have to drink something?
So I don't get up.
But when you get up in the morning, do you have to drink something?
No, I brush.
Okay, you brush. I know, but okay. One of the things that mouth breathers, this is common in mouth breathers. So what I would suggest to you is a couple of things. We do this breathing part that we do, slow breathing. and little holding. How many have you been with us where you did a little bit of breath holding?
Little bit.
Okay, so just try doing that. How many seconds are you able to breath hold?
More than 30 seconds, definite.
No, at the end of exhalation. So try doing that. Time yourself, and before you go to bed, do breath holding for about 3 to 5 minutes. Okay, breath holding practices. That's number one. Number two, tape your mouth. Taping of the mouth, regular tape. There are some tapes available, mouth tapes. Mukul Bhai will sell you one for no price. He says, I'm going to go out of business very soon if this happens. No, but the thing is, yeah, the tapes are available. The paper tape is fine. The mouth tapes are available. You do that, and then see what the difference is. You may find out that you will produce a little bit more of the gases that are needed, and we hope that helps. But give us a feedback.
Sure. Thank you, doctor.
Anyone else? Don't call me doctor. I just try to practice breathing.
Thank you.
Right. Anyone else? All right. Very good. Then we'll see you next Wednesday.
Okay.
Thank you.
How many? I think